Hi, everyone. We waited a minute. Let's wait just another minute to make sure everybody can join us. And welcome for joining our webinar today. So let's wait a few seconds and then we'll get started. So, hello, everyone. I'm John from OSP. Welcome to our webinar. Now, everyone in the healthcare sector is familiar with cloud networks. Patient records are usually stored in the cloud to support data exchange and interoperability. However, there may be another alternative that is better than cloud for storing patient data: personal health records, also named PHR. In our last webinar with Matthew Holt, we spoke about patient health access and its challenges. Today, we're happy to have Vincent Keunen, HIMSS 2020 digital influencer and the CEO of Andaman 7, to talk about a system other than cloud for ensuring patient data privacy. And it also has other advantages we'll discuss. Today, the healthcare industry is changing quickly, and patient information is often stored on cloud systems as electronic records. In the US, we call them EMR, EHR. But do they protect privacy of patient records? And are they easily accessible by all healthcare staff? So today, let's hear from Vincent about the concept of PHR, the need for health data security, and challenges and solutions for securely managing patient data with technology. So welcome to the webinar, Vincent. Thank you for joining us today.
Thank you for having me.
You're welcome.
And bonjour à tout le monde.
And we are different time zone. Welcome everyone, whether you're in the US or anywhere else. So we're going to begin with a few questions. We have a Q&A, Vincent and I, and then toward the end of the webinar, as soon as we finish, we'll have a Q&A open for everyone. So we welcome your text and your questions, and we'll address as many as we can. And if we need to, we'll go over the time for those of you who can stay. So my first question to begin with, it's been a while, but still, congratulations on being selected as a HIMSS digital influencer and healthcare change maker. So what can you tell us about your experiences as a change maker?
I think I'm the only one that is from outside the US first, so that's good because there's an opening to other parts of the world from HIMSS. Well, it's been interesting. There was a lot of activity initially, of course, with the COVID, it had been reduced. So, but it gives some visibility and it starts the debate. So it was a great experience. I enjoyed it.
Now, every change maker has a story to tell. So we'd love to hear what inspired you to really work so hard to make a difference in healthcare.
Okay, so I'm a software engineer by training, and I spent almost all my career building software for the health sector. And then in 2007, I was diagnosed with a leukemia, a blood cancer, quite serious one, because without a medication that exists now and existed at that time, you would have a few months to 2 years maximum life expectancy. So it was really a deadly disease, and I was very fortunate to be put on a drug that is extremely efficient and that restores your life expectancy to normal, right? So it's really from black to white, and it works for 95% of the patients that have that leukemia. So very, very effective drug. It's very niche because it only works for one leukemia out of many leukemias. And then leukemia is just one type of cancer, it's blood cancer. But it was not enough. 3 months after me, my son was diagnosed with a cancer too. He was 10 years old, very young. It was a bone cancer with a very, very low chance of survival, especially because it was very metastatic. So he had the cancer in the foot, tibia, both knees, shoulder. So very, very serious situation. He went into chemotherapy for almost a year, radiotherapy, bone marrow transplant, and finally, because the cure was successful enough, they decided to amputate him and remove his right leg. So you see two cancers in the same family at 3 months interval. For me, very easy to manage because I take a pill and almost no side effects, and the cancer is completely under control. For my son, it was ahead of a time, more than 1 year of treatment, then an extra year to learn to work with the prosthesis. And today he's still alive, thank God. It's been 13 years, but he was working with the prosthesis. So very different outcomes. So this is why I decided that we had to do something about contributing to research. That's one goal, contributing to research. And the second goal is to help patients get control of the health data, because it was very hard for us during that time to have access to the health data. And I felt that it was critical to have access as a patient.
Yeah, so certainly we often hear this can be a challenge. So what does your company do? Can you tell us more about your philosophy and the PHR concept and what your company does?
Okay, so for those who don't know, PHR is personal health record. So that's really a health record for the patient and themselves, as opposed to EHR, electronic health record, which is the term used in hospitals. So what Andaman does is a personal health record for patients that runs on your smartphone. So you can store all of your health information on your smartphone, not only medical, meaning data coming from hospital, doctors, nurses, labs, but also data about your activity, sleep, nutrition. So it's really anything about your health. It is on your smartphone, always with you, and it is only stored on your smartphone. Of course, there are backup mechanisms, but by default, there is nothing in the cloud. And the company, Andaman 7, the company that I created, does not have access to that data. You often hear about people saying, if the app is free, it's because you are the product, your data is being used. This is not the case here. The software, the mobile app is completely free for patients, and they can collect their data, control their data, and there is nothing that is done with their data by default. Only on some occasions will patients be invited to contribute to clinical trials and research. And if they consent, then they will answer questions through questionnaires, possibly share some of their health data, and that will help research. But by default, the project is social. What I want is to have the patients in control of their health data and on a global manner. That's why I developed the product in many languages. So it supports American and European languages, but also Chinese, Japanese, Arabic, Russian. So all the languages from left to right, top to bottom, you know, those complex languages, all of these are supported in the hope that as many patients as possible download the app and use it for themselves completely free.
Thank you, Vincent. Certainly what you're doing is innovative, and there is a lot of people probably on the call today who themselves have some ideas about deploying innovative and needed solution in healthcare. Would you mind sharing some insights on your process of developing your solution from concept to market?
Yeah, in my case, it was a bit different probably because I've been in the sector for 30 years. So I knew about health informatics, and I've also been a patient. And then I've been a carer for my son. So I've seen a number of different roles, and I had the feeling that I had a very clear view of what I wanted because I had been there, right? So I could say that I built the tool for myself first, what I would like to have had at that time. And then I talked to a few others, my daughter, who is a pharmacist, and my sons, and then friends, and then doctor friends, and then other patients, and gradually we improved it. And so what was challenging is that I did have experience in building health records for hospitals. And here I wanted to have that same information be presented to the patient, which is a completely different matter, because in a hospital, you have health professionals, doctors, nurses, and they know they know about the subject, right? They know what they're doing. As a patient, you don't understand much of that information. So we had to display it in as simple a manner as possible. And if you open Andaman 7, you will see that it looks simple, but that means it took us a lot of time to make it simple. There's a French philosopher, Blaise Pascal, that says, he has a saying that I like very much. He says, "I'm sorry I wrote this long letter. I didn't have time to make it shorter," right? So this is very indeed what we did. We took a lot of time to make things look very simple for the patients.
Thank you. That's the expression we have in the US, KISS, keep it simple, stupid. Yeah. But certainly in a dashboard for patients, families, and healthcare staff, administrators, and insurance, it is very important to have the right information that's simply presented. Now, if we can move into security, can PHR be more secure than cloud-based systems?
I really think so. I really think so. A cloud-based system can be secure, but everything that is in the cloud will always be a constant fight between hackers and defenders, right? And they're always going to find smarter ways to infiltrate systems when they should not, and then the defender will always make it more difficult, right? With the distributed approach that we took, the data is, my data is on my phone, right? My wife's data is on her phone. So there is nothing in a central place. So for a hacker, it is a lot less interesting. He would need to hack my phone, and if he would succeed, he would have access to my health data and maybe my children's health data. So just a few health records, it's no big deal, right? You cannot do much with that. For it to be successful on a large scale, you would need to attack many phones at the same time, which will be much more difficult. It's always possible, but so the distributed aspect is very important for me, because this is a bit what one of the elements that GDPR says is that security must be by design, right? And so when we designed the system, we designed it so that there was no data on a central place. Everything was distributed. So I think that there we took a big step forward for having a very high security in the system.
Right. Well, thank you. Now, beyond security, can you give us a brief comparative analysis of PHR versus current solutions that have been used from your point of view?
What current solutions do you mean? Other PHRs or?
Yeah, well, it could be, of course, a cloud system, or people are trying to think creatively. How do we handle securely patient information? But even beyond the security, what's the advantage, for healthcare staff, for patients, for insurance? There is many different parties involved, and how do you see, the comparative analysis, if you will, is possibly your competitive advantage?
Okay, yeah. So today there are many people that are trying to improve the system by creating some kind of patient portals or collecting data on a central server in the cloud, and having patient register and put their data. And all of these, I believe, are risky for security reasons and for privacy reasons, right? So this is why we created Andaman as a distributed system. You might recall, if you've been in the industry, that I think, 7, 8 years ago, Google tried to do Google Health, right? And it was a place where you could put your health data. And at the same time, Microsoft created Health Vault, right? And they started to compete. And after 2 years, Google stopped the project. They completely canceled it. Microsoft tried for, I believe, 5, 6 years, and they stopped one or 2 years ago, right? And so when I was in the Valley and I was talking to the sector about PHR, everybody was telling me it's never going to work, because Google and Microsoft tried and they failed. You're not going to succeed. And then what happened recently? Apple came out with a different solution, right? They allow you to connect with your iPhone to your hospital. The data is transferred from the hospital to your iPhone. Of course, it's scripted. Of course, it's scripted. It goes through the internet, but nothing stays on the internet, on servers. It's not on Apple servers, right? So it's a distributed system. So what Apple did is very similar to what we did. Actually, I'm a bit proud, but I was at Cupertino talking to one of the head of health at Apple 4 or 5 years ago. And he was impressed by what we were already doing, because it was what Apple was going to do, right? So he said we were very well aligned on the privacy matters and on the architecture of the system. So yeah, now that Apple is showing that way, suddenly everybody says, yeah, PHR may be a good idea. But many people do PHR in a simple way, a web application stored on the cloud, because it's easy to do, but I don't think it's a very good solution. It's not a good solution for security, and it's not a good solution for privacy. So putting that on the smartphone like we did is much harder technically. But what we also did by doing this is create probably one of the first collaborative distributed health records. I've looked on the internet to find others. I have not found others, so I don't want to exaggerate, but I believe that we may have created the first distributed collaborative health record, meaning that various points in the network can add data to the health record of a patient, and it gets distributed to the other ones. And no one is the master, no one is a slave, right? We just know who entered what information at what time, and it gets distributed to the other points of the network. So I think that is pretty innovative. I'm not sure we're the only one, but I have not seen another one doing that as yet.
Okay, I'm going to diverge a little bit. Someone just put in a question, I think, that is relevant to what you just said. They mentioned that they've looked at the Apple health system, and they find it a bit cumbersome for patients. And how would yours differ and be easier to use, less cumbersome?
Exactly. That's what I was referring to earlier, right? A health record is by nature complex. There is a lot of information of various types, and it can last for a lifetime, right? So it's always difficult. I know that Apple has done has revamped their health application at least twice, I believe, right? It's the third version. Some people like it, some don't. We try to create a very simple view of a limited number of sections that people are used to, like drugs, allergies, consultations, contacts, and we put the minimum of them, and then we have a plus button where you can add additional information, right? Because it's always very difficult with health records. The needs of people vary a lot, right? A diabetes person with a heart problem, or person with sleep problems, they have very different needs, and the lab results are important for some, not for others. So you always have to be able to allow any kind of information to be there and to be input, but at the same time, you don't want to have all of that present at the same time, otherwise it looks very complex. So we try to find the balance by showing the limited number of sections that most people are used to, and then for the rest, they have to add it. But still today, some people ask us, you're missing this, and others say, there's too much in this list. Right. And people say, yes, but you're missing this in the list. So it's really complex. And I don't know if there is a magic solution, but people have to be educated partly, probably, and yeah.
Right. Thank you, Vincent. That's always simplicity and relevance to each patient is going to be key. Yeah. Now, do you see any obligation that may come from healthcare organization or government organization? That's going to be a little challenging, possibly.
Obligation. What do you mean?
Requirements, you know, is there some, of course, I'm sure you know GDPR, HIPAA, HR7, all of that is important, but beyond that, have you had any feedback from healthcare organization or government? Maybe they're worried about patients not having their own information, or how would you respond to that?
Yeah, there's all kinds of fears, of course. That's very true. And there's a lot of education that needs to be done. My experience is that healthcare organizations don't have a natural tendency to share their data with patients for many reasons, some good, some not that good. And so what is really needed is the national authority, the government, to say the patients have a right to have their data, which is in the law, right? It's already in the law, both in Europe, in the US, and in other parts of the world. There's a law on patient rights that dates back to 2002, and GDPR, and now similar acts in the US, like a California Act, Privacy Act, Brazil Privacy Act also. All of them are going in the same direction, saying that the patient or the citizen should have access to their data. They have a right to have access to their data. So there should be a push from the government. And I can see that very clearly because in the US, Obama did that a few years ago. He imposed on all healthcare organizations to use software that is interoperable with what is called an API, Phr API, which means it's a software that can be contacted by other software and can exchange information. Since he did that, there is a huge amount of innovation in the US where any company can have access to, if the patients agree, of course, can have access to some health data. For example, Andaman, even though we are a European company, we were one of the first ones to be compatible with 85% of US hospitals, with partners, of course. We don't do that alone, with partners. So that's very good in the US, but we are in Europe, and in Europe, we don't have that. We don't have any authority that is imposing to hospitals or healthcare organizations to share the data with the patients. At least they say you have to share it, but they don't say how. So they print it out on paper, or they put a CD-ROM, which is useless, right? So we are getting late in Europe because of that lack of government insistence on sharing data with patients.
Okay, a couple of really good questions came in, but before we get there, of course, every new application created, every new solution is important for the right audience, the target population. Can you tell us from your experience so far, have you seen any trends, different acceptance level or concern in Europe versus in the US?
What I can tell you is that older people are users of the app. That's pretty surprising. Well, it is and it isn't, but sometimes we say older people are less comfortable with smartphones and so on. I don't think that's really true. Of course, young people have less health problems than older people, right? So that also makes a difference. But what I think is that in every age interval, I don't know how to say that in English, chaque tranche d'âge, how would you say that?
Segment, yeah.
Okay, in each age segment, there are early adopters and laggards, right? So it's just a question of being compatible with technology. Most of our users are over 50 years old, right? So that's very clear that older people are comfortable with using that. We also have seen that if people can get their data automatically from their hospital or labs directly in the app, they use the app a lot more. And that's natural, right? Because in entering data yourself is always cumbersome. It takes a lot of time. So these are the two elements that struck us. Otherwise, as many men as women, more or less, we have downloads from 35 countries. Of course, we are better known in the US and in Europe, especially in Belgium and countries around us. But yeah, one other elements I can mention also is chronic disease patients. When you're a chronic disease patient, you use the app a lot more than when you have just one element of health, one health issue at one given point.
Okay, so mostly you've noticed differences in pattern depending on not necessarily on where the patients are located, whether it's Europe or the US or somewhere else, but more about the attitude about health, whether they have a chronic challenges or the age group, and that seems to me.
Yeah, correct.
It's very, very interesting. One of the questions that came up is, you can answer it now because we'll get to it eventually, is some of the people online want to know, is a product available now? How is it available? Where do they get it? And
yeah.
I'll mention another one later. Go ahead.
Yeah, there's also one on money. How do we make money? I think it's very important to answer that one too. So yes, the product is available. It's been available for a few years and we keep improving it all the time. You just go on either on the App Store if you have an Apple device, or on the Google Play. If you have an Android device, you search for Andaman 7, Andaman in one word, Andaman 7, and you search and you download and you install, you register. You need to register so we can identify a unique person, and then you can enter the data and you can, if you are in the US, connect to your hospital. If you cannot connect to your hospital because it doesn't work for that hospital, or you're in another country, then you can still use the app by entering data, by taking picture of documents. If you receive PDFs or text or files from your hospital by email or other ways, you can put all of that in your Andaman 7, and you gradually build your health record over time. So that was the first question, I believe, right?
Right.
Did I answer completely?
Another one, which is interesting, if I may, I think people understand, they'll be able to get it, and we'll give them your information anyway, your website. Another related question is interesting, is some people here listening want to know, what is the value or the advantage for healthcare organization or for medical practices?
Okay, for medical practices, okay, for patients it's very clear, right? Some people tell me your app is vital to me, right? Because what really happens, as you know, when you go see a doctor, they ask you questions about your medical history, your allergies, your drugs you're taking, and so on. And everybody forgets a large part of that. There has been studies. We believe we know, but we forget. We really forget. So having everything recorded on a smartphone is much better for you. And then you will give much better information to the doctor. So now if we take the value, what's the interest for the doctor? Well, they have patients that have better information about themselves. So they have a lot of information. Sometimes they can go faster if they don't need to do additional tests. In my case, I was very tired one day. I went to the specialist and he said, okay, he asked me a few questions, and then you'll have to take a blood test, and then we'll see each other with the results of the blood test. And I said, but I have leukemia. I have a 2-month-old blood test. She said, yes, good, but I don't have it. I said, I have it on my phone. Do you want to see it? And then she took my phone, she looked at it and said, you don't have a problem with your thyroid. So instead of having 2 consultations and 1 blood test, I had just 1 consultation, and I had my immediate diagnosis or lack of diagnosis in this case. So for patients and for doctors and for the whole systems, it's really a lot of value. Another element I could add for doctors is that if they have patients that know their information, they are able to better serve them, right? And also there's been studies showing that when patients are really engaged, and they put to be engaged, they need to understand, then the treatment is more efficient. So it's really in the interest of the patient, and the doctor's goal is to cure the patients usually, right? So it's really a tool that can really help the whole system function better.
Okay, thank you. Yeah, there'll be related questions. We can get to it in a little later. But tell us, patients and providers like using platforms or applications that really are simple to access with a device. Can you tell us, is PHR compatible with any device, or which one are they compatible with?
Okay, so we are compatible with hundreds of devices, but for that we do rely on what is called middleware software, which is different on Apple and on Google or Android devices. So we cannot, as a company, build the interface to the thousands of devices, right? But there have been standards defined by Apple and by Google. And so if those devices are compatible with that interface, then they are compatible with Andaman 7, right? So Andaman can take the data from any device that is sufficiently supporting the standards that have been defined by Apple and by Google. If your device is not supported, then you should really talk to your device provider and say that they should be compatible with the standards that has been established. And then, well, and today there's already hundreds of devices. There's a question on money. Can I answer that?
Yes, please. Yes.
Because the app is free, how do you make money? It's very important, right? And as I said earlier, many people say, if the app is free, then you are the product because your data is being used. This is not the case with Andaman. We are patients initially. We want to help other patients. So we really do offer a free solution where you have your data and your data is not used. So we cannot make any money from that. How do we try to make money? If it's by talking to pharma companies that need to run clinical trials for the new drugs they're developing, or for the new devices, device manufacturers, they need also to run clinical trials. What are clinical trials? They are basically questionnaires that are being sent to patients. Number of questions, you answer them, they take the answers, anonymize the information, and see if the drug is efficient or not, what are the problems, side effects, and so on. That is what is a clinical trial. So what we offer to pharma companies is the possibility to share electronic questionnaires to patients through Andaman. And that always goes usually through the doctor of the patient. So the pharma companies contact the doctors. Do you have patients that have there are men over 50 years old that have had prostate cancer, for example? And if the doctors say yes, they contact the patients. Do you agree to contribute to a trial on a new drug for prostate cancer? And if the patient says yes, then they are put on Andaman to receive the electronic questionnaires and so on. And the pharma companies pay us for that, right? So there is always the doctor that is somehow controlling, and there's always the patient that is consenting to be part of a trial. That's how we make money. And we make money because we want the project to be sustainable, of course, in the long term.
Yeah. One underlying question, I have a couple more, but it's come from people and it's come in my own mind. Can a patient download the information from medical practice rather than a hospital? How easy is it for patients to capture information from different places where they come from?
Okay, yeah, good question. So this is improving over time, right? What we do with Andaman, we use partners to get access to the hospitals. There are a few of them in the US. Apple is one of them, by the way, right? So if Apple is connecting to a hospital and getting your data back to your phone, that data can be put in Andaman 7 too, all right? So for us, Apple is a channel to hospitals, and we use others, right? And we don't want to be too dependent, and we want to open possibilities. So we have several channels. And those channels are the real guys that do the work of connecting to the hospitals. So some of them connect to hospitals, then others connect to labs. And then when that is successful, they work with medical practices, and then they will work with individual doctors, and then they will work with software from clinics. And maybe some will work with the veterans systems, and then others will work with payer systems or claim systems. So all of these are gradually opening up thanks to the channel we're using. And for us, we don't have any work to do almost, right? Our partners develop more and more, connect to more and more sources, and then those sources come into our system, and more patients will be able to collect their health data. And it's difficult, right? Because even if we are connected through that channel to a hospital, it may be that the hospital is not sharing the data correctly. It may be that the doctors don't have time to enter the data, or they enter it in the wrong way. So let's not oversell that, right? It's a big improvement, but there is still a lot of work to do. So if you try it, if you install Andaman 7, you connect to your hospital, and you don't get the data you expect, please contact us, contact our support, so we can see why it's not working with that hospital specifically, right? So don't be discouraged, contact us.
Right. And another interesting,
Support
yeah,
Andaman
another interesting
at Andaman7.com. Sorry.
Sorry,
Go ahead.
apologies. No, I wanted to say another related question came in, which is interesting. I hadn't thought of. Obviously, in my mind, and I think in the mind of others, it's going to be existing even with your personal data being owned by the patient. EHR is still going to be maintained. Some folks are worried about EHR, will maintain possibly better because there's going to be changes. There's going to be new knowledge, new information. And then how do they still communicate? Will there be some links, or do the patient have on occasion to update information or communicate with the EHRs?
Yeah, actually, the opposite is true. The EHR in hospitals, there has been studies, 30% of the information is wrong as a mean, right? It's huge.
We've heard the same, yeah.
Yeah, why? Because doctors don't have time, so they are missing information, or it's interns that are asked to put the information and they were not well aware of the situation, or the doctor prescribed a drug, but then the pharmacist said, no, this is incompatible with the other drug, I will substitute it, and it doesn't go back to the doctor, or the doctor says, you have to go to the physiotherapist, and then there is something happening there and it doesn't come back to the doctor. So there are many reasons why the EHR in hospitals are not up to date. But studies have shown also that when patients see the data that is in the EHR, they can very easily point to what is wrong and correct it, right? So when patients have access to the data can be improved, corrected, okay? Right. So with Andaman currently, we can download the data from those systems into Andaman. Andaman is also able to to transfer data to the hospitals, but this is very new to hospital and it's very hard to do. Why? Because all the system in the hospitals, like the Epic, Cerner, Allscripts, all those systems were built for health professionals, right? They never thought that a patient would input data there, right? So it's hard to know that this data in the system comes from a patient already. And that's important for the doctor. He has to know, does this come from a colleague of mine that is a doctor, or does this come from the patient? Because I want trust, put the same trust level maybe, right? Or I want to have some confirmation. And if I, as a patient, take my blood pressure 2 times per day, every day, and then I send 6 months of data to my hospital, that's a huge amount of information. They're not used to that because usually the patients come, once every few weeks and they take the blood pressure once. So there is also the amount of data that's going to change, right? So all of these systems in the hospitals, unfortunately, are not ready yet to take data from patients today. So that's something that they will have to improve on. And Andaman is ready to send the data, but nobody's there to receive it for the moment. And it's unfortunate because the patient can fix the data on their smartphone inside Andaman. And when I say fix, it's not changing, right? In Andaman, we never change, never delete. It's always new information that we add, right? So there is always a full traceability, a full auditability of the data of who did what, when. And so when the patient changed data, it could be sent to the hospital. And if the system was able to receive it, it would be shown that the patient entered that data at that date and the doctor entered that information at that date, and it's not consistent. So what do we do with it? At least it becomes clear that there is a problem, and then we can talk and see what's the right solution or what's the right information.
Yeah, this is very interesting because even identifying that there is a different opinion from the patients or doctors and what the problem might be might uncover very interesting information. I know for me, actually, I'm here in California. I'm part of the UCLA health system. And it was interesting because recently I had my yearly physical and I was able to go into the EHR system and I added information they didn't have about past history, family history, things of that nature. So I think I'm going to try your application and see how the exchange might work. Now, to go back to you, obviously, PHR is great to enhance patient empowerment for data protection. What would you say are other must-have features, or maybe even new features you're thinking about, and how easy will it be to add new things?
Yeah, Great. Yeah, great. It's important indeed. So what we have already in Andaman, beside the PHR itself, is a module for medication adherence, right? So what does that mean is a system that helps you take your medication at the right time. So basically it's reminders where you can schedule and then you can say, I took it and so on. So you have some kind of follow-up of your drug intakes. And then for the revenue part I told you earlier, we have a module for clinical trials that are already there and that can be used by pharma companies or device manufacturers. What we also have is consent modules to very clearly register that the patient gave their consent for this part of the data to be used. Now, I consider the PHR as a foundation because it's the data layer, right? It's like the foundation of a house. And on top of that, you can build many things. And we don't want to build them ourselves, right? So what we did, what we built is a integration layer, a services layer. So if you click on the fourth button at the bottom of Andaman, you will see a list of categories of services. One category can be book a meeting, book an appointment with your doctor. You click there, and then you see ZocDoc in the US, you see Doctolib in France, you see Doctina in other countries of Europe. And so you can directly access the booking system of your local area, right? We have another category, which is buy your medication online. And then there are online pharmacies that are listed there. And then you have another one, find a clinical trial. And then we contact some of our partners that are doing that, like Antidote, like Trinetics. And all of these extra services can be accessed by the patient. And so there's a shallow integration, so the patient can find all those services. But in the future, when we work with those partners, there's going to be the possibility to better integrate even. Like imagine you're going to buy, you received a prescription for from your doctor on your Andaman 7. You say, okay, I want to order that from an online pharmacy. You connect to the pharmacy and you say, I want to order this drug for me. And the pharmacy say, would you mind sharing the other drugs that you're taking currently? And if you say, okay, I consent, then you, Andaman, would send your other drugs to the pharmacy and they could run a software saying, looking at the incompatibilities between the drugs, right? And they could say, oh, the one that your doctor is prescribed is not compatible with this one, or there might be side effects. So we will replace it by another one, right? And then they would replace it, send that information back to you that would be stored in your PHR. And in an ideal world, that information would go back to your doctor. So it would know that the drug it prescribed has been replaced by another one because there were some drug-drug interactions, right? That's just an example. I have another one if I'm not too long.
This is very interesting. Yeah, we want to hear more, sure.
Okay. Suppose we also have a category, get your DNA analyzed, right? And there we have a connection to 23andMe, to MyHeritage, and to a number of companies that do DNA analysis, right? What could happen in the future is that as a patient, you say, I want to have my DNA tested. And then that company says, okay, we're going to do this. Would you agree to share your health information with us so we can, how do you say that, match or combine your DNA analysis with your medical history and maybe find new important insights? If you say yes, then your medical history would be shared with that company, 23andMe or another one. They would run your DNA tests and they would probably be able to provide more insights on your risks and so on. And ideally, those insights would be downloaded again in your PHR, in your Andaman 7, and be part of your PHR. And then if you're sharing your PHR with your doctor, automatically your doctor receives the insights from 23andMe given your medical history. This is going to be very, very powerful, right? And there are a number of examples like that where a very good integration of services like that can really, really push the the medicine forward and probably reduce the cost significantly too.
Thanks, Vincent. This was very, very interesting. And actually, it ties into the next question, which is, what do you think the future of PHR looks like? And what do you think about trends across different nations? And somewhat related, have you already imagined not only the growth of PHR, but also what new technological innovation could create, what potential competition or new ideas may have, powerful future, implications?
Yeah. Or we could talk about competition, right? But I'm not here for making money, right. And I'm mainly here for helping patients, right? So everybody that succeeds in helping patients, I think we are more collaborating than competing. I like to say that at least. How do I see the future? Well, it's incredible the number of people that I've shown Andaman to, and they say, it doesn't exist. How come it doesn't exist? It's so obvious. It should, yeah. Now that you tell me, I realize that it doesn't exist and it should exist. It's just incredible. Today you have on your smartphone, you have your picture, you have your music, you have your bank, you have all your information, but not your health data. What do you need when you're in a difficult situation, right? It's probably the most important information to have, and we don't have it. So I think that in a few years, it's just going to be obvious to everybody that you should have all your health information on your smartphone, and it should be easy but safe, easy to share it with your doctor or with other people in case you need it. So I think it's just very obvious that it's going to be pervasive to all smartphones in the short term.
Well, this is great. Thank you very much for everything you shared with us and sharing your valuable insights. We really wish you the very best success through 2021 and in the future. We're so glad you came to join us in this webinar because we think what you're doing is really valuable. And I've heard conversation around me, friends, and as well as professionals and clients who are venturing into that area. So I think, like you said, the future makes sense. Go ahead. You want to add something?
Yeah, I want to add something. This project is very ambitious, right? We're a small company, so we need all the help we can get. So we're looking for investors, we're looking for partners, for people that want to use our platform and promote it and help us in any way, because I think there are a lot of good ideas, but also it's very difficult, right? The problems are challenging. If you want to do it in various countries with different languages and different legislation, it's really a huge problem. So we're really looking for investors, partners that would help us reach that goal of helping patients be empowered, really.
Yeah, thank you, Vincent. So some people are asking again, and now is the time, by the way, for a Q&A session. So please, everyone, if you have any question, add them to the Q&A or the chat if you prefer. And
the chat,
so that
they're asking how to contact me. I just put my email in the chat. It's vincent.keunen@andaman7.com. First name dot last name @andaman7.com.
Thank you so much. I was just going to share it, but it's better now you typed it in. Thank you very much, Vincent. Yeah. So anyone, if you have any question, please go ahead and post them. And so to get it started, I see a couple of questions. So let me get started with that. Do you foresee that the free app, because it is a free app right now, your PHR application, do you think it's going to be chargeable in the near future?
I hope not. I will do everything so that it does not happen. So I hope that we will get enough revenue from pharma companies, from device manufacturers, possibly from hospitals later, if they find it useful to have Andaman to collect data from patients for remote monitoring of patients, right? Because getting the patient to the hospital is always costly, right? So it can reduce the cost of having the patients stay at home, and it's more comfortable for the patients too. So I hope that we will be able to get enough revenue from these B2B. If it's not sufficient, that maybe we'll ask for donations from patients, because maybe some patients will be happy to give us some money. If it's not enough, maybe we will try also to add additional services that would be that would have a price, so that some people that have more means would pay for those, and that would contribute to the general system. So these are the few ideas that we have had, but yeah.
Sure. I see several questions about blockchain for security. Do you have any, what are your thoughts about blockchain?
Yeah, so blockchain is a very interesting technology. For the moment, I see blockchain mainly as a very good technology for securing transaction in the distributing world, right? There's all kinds of tests and experiments to use blockchain for other things. I don't see many being successful. What I see is many people saying blockchain is a magic bullet to solve all the world's problems, right? So I think there's too much hype around blockchain, unfortunately. So in the health record world, I don't see a lot of uses for blockchain for important things. Blockchain would be important, for example, if you wanted to trace the fact that some information has been exchanged from point A to point B. There you could write the transaction in a ledger and have a proof of that. That's interesting. But there's so many other problems that we need to solve before that's probably for later, right? There's also immutability issues that is mentioned, which is true. Blockchain could be used for immutability of data. But mutability of data is not a major problem today, I think. There's much more important problems about just data access, just data storage, the data format, data interchange, security aspect. All of these are so much more important than immutability of data. So yes, blockchain will be interesting for some specific use cases, but I don't see personally blockchain as being the revolution that the healthcare needs. I don't think so. I think it's going to be more about interoperability, about good standards like FHIR, about good tools for the patients, for doctors, and sufficient security and sufficient privacy so that everybody can trust the systems. I think these are the most important elements.
Right. You probably noticed a few more questions have come up, and there seems to be a trend. One of them is some folks are asking again about the value and advantage to healthcare organizations or hospice settings, care providers. Maybe you can recap or expand a little bit on that.
Yeah. So first, when the patient are well informed, the doctors are better informed too, because the doctors usually ask questions to the patients, right? And most patients forget a lot of things, always. Even if we think we have a good memory, we always forget a lot of things. So for doctors, having patients provide the right information or complete information sometimes can be very, very important. So that's one big element. A second element is that patients that are empowered and they have the data and they understand their disease more or less, right? They are not specialists like doctors, of course. Doctors will always be needed, but at least they understand a bit better and they know what to do. Their treatment will be more efficient. It's been proven, right? There have been clinical trials showing that patients that understand their situation have a better outcome. So these two reasons for me are already sufficient, right? For using, for sharing data with patients. There's a question about data storage and how much data.
Yeah.
It's surprising, but it's quite low actually. There's one exception. The exception is if you have a lot of images of very high quality, that's difficult to store on smartphones. That's true. But usually you don't need to store all of those data. Usually when a radiologist takes 50 pictures, there's 1 or 2 significant images, right? That need to be stored. And even then, for the family doctor and for other doctors, they usually don't look at the image. They read the protocol, the text that the radiologist wrote, right? So it would be good to have the images, but it's not even necessary in most cases. And if you put that aside, all the rest is really light data. I have on my smartphone my health data, the one from my children. I have a few demo records, and all of this is taking a fraction of the memory that the pictures in my photo album takes, or a fraction of the music I have on my phone. So it's really, really a small amount of information, really, compared to the rest.
Right. So it seems to me, and someone mentioned it, the idea that what, PHR will be really helpful for prevention, for precision medicine, to really understand better the patient and do preventive care, which of course will save time and money for everyone.
That's very true. And actually, I think that we are now slowly solving the main health problems of the world, right? The problems that large populations have, they are being solved gradually. Probably, today, 50% of cancers can be cured, right? So that's a huge improvement compared to 10 or 20 years ago, right? So that means that in a few years, we could hope that, except new diseases like COVID-19, and obviously there's going to be new ones, but for most diseases that affect a large part of the population, we will have the solution. And what will be needed more and more is solutions for rare diseases, rarer and rarer diseases, right? Because today it's not cost efficient to develop a drug for, say, 3,000 patients in the world, right? You have to amortize the whole cost on 3,000 patients. It's difficult. So when medicine will improve, I think there's going to be no choice than to focus on those rare diseases more and more, and that's precision medicine, right? Because the disease will be really specific to some patients, and even today we know that a drug for two patients that have the same disease, the same drug works for one and not for the other one, and we don't know why. It's probably in the DNA somewhere, but we don't know. So that is also going to be precision medicine, right? So I think precision medicine will be a big trend. And I think that a second big trend is that patients are becoming health consumers, right? It's not like 20 or 50 years ago, you're sick, you go to your doctor and you have only one doctor, your family doctor, right? Now you have at least 10 doctors, your family doctor, then the radiologist and the oncologist if you have a cancer and so on. So it's an army of healthcare professionals, and also you may want to change, right? My son, the first doctor, did not diagnose his cancer for several months. So after some time, we were fed up and we changed doctors. And this second doctor, it took him 3 days to put my son in chemotherapy. You see, and because of that, we lost 6 months of treatment, and the cancer had metastasized. I don't know how to say in English, sorry. So sometimes it's really important to switch to other doctors, because of course there are better doctors than others, but also some might be focused on an ID, and having another fresh ID might be interesting. I don't want to criticize doctors either, right? It's sometimes difficult. And when you're early in the disease, it's more difficult also. So voila, so for all of these reasons, I think we need to go into health consumerism.
This is great, thank you. I can tell from some of the questions that some people will want to contact you to ask questions, or potentially to consider partnerships. So okay. I'm going to ask you again to share your email. And by the way, for everyone, we are going to share a recording of this session, and also information on how to contact Vincent or to contact me and OSP. We'd be happy to respond to your questions and make contact. So to conclude, I really want to thank you very much, Vincent, for sharing your point of view, your experience, and the very valuable solution that you are creating now. So I think this was really helpful. Going forward, this will be published on osplabs.com, osplabs.com. You can email me at john@osplabs.com. And Vincent, if you want to share your information one more time.
Yeah, okay, it's in the chat there. I can also, I don't know if I can, yeah, no, in the Q&A, no, but in the chat, yeah. It's my first name dot last name at andaman7.com. But if you search for Vincent Keunen, the name is on the invitation, on the email you sent. If you search on the web, you will find me on LinkedIn, and then you can contact me also via LinkedIn. Yeah, my email is in the chat there, so you can leave the chat open for some time if you want. You're muted, John.
Apologies. I wanted to thank you again. And any last words before we end this webinar session?
Thank you for all those attended. Please take control of your health data if you're a patient. It's really important on some occasions. It can be a difference between life and death, really. So take control of your health data, push your family to do it, your friends to do it. And if you're a professional, please help us. Come talk to me to help us develop the project, to invest in the project or to donate to the project, and help us promote this so that more patients in many countries can benefit from their health data and be in better health.
Absolutely, thank you. And I don't see this competing with EHR, EMR. I think both can exist and really complement each other. And I mean, I can imagine traveling and an accident happens. You know, my EHR, EMR is not available to the people who are coming, you know, to an emergency. So having that data and then having access to the other one, I think is a great complement. So again, thank you, Vincent. And to everyone attending, thank you for coming today. So stay tuned, stay safe, and until our next webinar, but thank you very much and have a wonderful day. Bye-bye now.
Thank you, everybody. Bye-bye.
Bye, Vincent.
Bye, John.